Hello, this is Ellen Madono, and I'm speaking to you from Tokyo Homeopathy. My project is to teach you, who I assume is a beginner, to learn homeopathy. I'm going to teach you to learn it the way homeopaths learn it. The method I'm going to teach you will bring consistent success much earlier in your study of homeopathy than the way I began homeopathy 20 years ago. I assume that you are like me. You want to use homeopathy to decrease medications and surgery. I've done this with my family and myself, and I feel very successful. I started from the beginning, amazingly enough, treating people. And I've continued. Doesn't mean I treated waiting rooms full of people, but I treated people consistently for 20 years, and they were my best teachers. I learned on the internet, I learned from books. There's lots of information available. But the fact is, we need to treat real people. Interviews in person are always better than treating online. There's a lot to learn from the patient that you can only get by actually meeting them at the door, shaking their hand, seeing the way they hang up their coat. And when you treat people like this, you become aware of yourself and your patients also. If they're self-aware, they're the easy kind of patient. In my experience, this self-awareness isn't actually a kind of, aha, I know who I am, I know what the truth is. It's more how I actually feel now. I'm present in the moment. And in my case, how my body feels is actually a very good sign of how I feel. Doing homeopathy is very much a project of healing your own self. When you treat other people, if these people aren't able to express themselves, it's the caretaker who you need to thank for their help in the treatment. Good, observant caretakers can really help you. We're all advised to choose easy cases at first aid cases, dental cases. Everyone knows you use arnica after a dental appointment or after any surgery, but there's more to it. Sudden colds and flus can be more complex than a wound. It's just that the information is more complex. You need to have more information. Often it's good enough to have a home self-care book. But what I want to teach you is a way that you can be very certain that you're right. Because when colds and flus lead into something like COVID, you want to be correct all the time. You want to have a very high level of reliability in your database. If it's a wound like this, you first think, give arnica. That's the correct way to think. Arnica will help in the beginning. But then you need to ask the patient what feels worse. If this young woman is worrying about the infection that seems to be starting up here on her forehead, then it's actually calendula that will do more for her than arnica. If it's the bruise and just the wounds themselves in kind of a generalized way, sure, arnica is great. But if it's the pain that really bothers her, then you should give hypericum. So you can learn these kinds of remedies as actual sets of situations that are very familiar. Just going to a self-care book, you can actually find this kind of information. It's not very difficult. Online is great also. There are other kinds of emergency situations where just knowing what the problem is it a bruise, is it a sprain, is it the anesthetics, nerves being cut, is that the problem after post-surgery? Yeah, that's That's important information to know, and that's what's going to find you the correct remedy. But when it's something more complicated, such as grief, then you need to think, at the beginning, what happened? Did they get all excited and hysterical, or did they withdraw? And they withdraw more and more, and the grief itself became part of their personality. These are different stages of grief, and you need to think about which one it is. Many times these kinds of situations come to you. You don't choose them. It didn't happen to you. It happens to someone around you. They know that you do homeopathy, and they come to you. If it's, for instance, this grief problem here, that's all involved in the person's own personality, this has already become a little bit complicated, and you're going to want to know more. But I'm going to show you ways to actually figure this one out with very obvious kinds of information, not only having to know the psychology of the patient. So chronic treatment tends to be more difficult. Let's kind of look at some of the characteristics that will help you to understand if this is a chronic case or if it's an emergency, something that's right on the surface that's very obvious, what we call an acute case. Is it chronic or is it acute? Now, there are some things that are just obviously broken. This looks like a broken window in a house that is not in good repair. Can this be repaired? Homeopaths and this think it often can be. But when you have the same symptom, this is what comes to you, occurring over and over again, when you have a cyclical symptom, then usually there's a false recovery in the background. In this case, you should suspect that something chronic is happening. There are symptoms. People are telling you the symptoms of the problem. It could be a disease, it could be a wound. And then there are places where there are no symptoms, and there are new symptoms that are unrelated or apparently unrelated. That's what happens when you have this kind of false recovery and repeated bouts of the same symptom. Why does this occur? Usually it's because of medications. It's because of something that we call suppression. Emotionally, if you have anger, you can cover it up by smiling all the time, or you push it down inside you, and then suddenly you blow up. These are both different kinds of suppression. When it's medications that are suppressing symptoms, it happens for reasons that we can't see on the outside. In this case, they're using something to stop the functioning of the body, the normal functioning of the body, so that the problems caused by obesity don't occur. But the normal functions of the body are not happening. It's very interesting that the patterns that happen emotionally inside also happen on the outside. The same patterns repeat themselves. This is the symbol that I use for my website, this spiral. And it happens everywhere in the universe. There's this same pattern. So when you have a pattern of suppression like this, emotional suppression, without even medications, you can have suppression. The case based on drugs is easy to understand, but the one that's based on emotion, that's often also being suppressed along with the physical symptoms, is less easy to understand. But you don't need to understand it all with homeopathy. Just understand that this kind of thing happens. And when you use the right remedy that you chose for reasons that are unrelated to this, because you don't actually know this kind of thing when you talk to the patient, it's not obvious. In this case, you just understand that something like this could be happening. Another reason to suspect that something chronic is happening is because there's a disease that doesn't have a name. These diseases, these problems, are not covered by insurance. The person who has the problem may come to you for something that's superficial, like a wound, or something that doesn't look like a big problem. They are not hypochondriacs. They're not looking for a problem. If the doctor told them that they don't have a problem because there is no disease category for them, they feel bad for no reason. They're not necessarily hypochondriacs. And you actually find out later, because in this kind of case, the symptoms come out gradually as you treat them for the things that are more superficial. Okay, we're going to go back to easy patients. Okay, we were in that, getting into that deep, difficult hole, which is not where you begin anyway. And the history of easy patients usually involves few medications or surgery. They can actually have lots of medications and surgeries, but they're aware of them. They understand what the consequences are, and they feel them. These kinds of people are easier to treat. And they also desire to reduce these medications, to have fewer surgeries. These people want to rely on nature. You can tell by their lifestyle. Their lifestyle has more connection with nature. Finally, they have social support. Gradually, you find out that they aren't all alone. But there's people with plenty of social support, but they don't feel connected to those people around them. These people are also lacking social support. This man is reaching out and asking for kindness, and he looks like he has no one to support him. But if you talk to him, it's possible that he does have feeling for other people, a feeling that he's connected to other people. This is the sort of thing you can't tell by the external circumstances alone. When you hear a case or hear about some problem, and it's possibly more chronic, you think about this situation to see how difficult it is. You know, when the broken light bulb comes to you, you don't necessarily say, I can't help you, because it's not true. You size up the situation and you at least help them with the superficial things that can be easily helped. Often it does lead to the deeper aspects. So in that case, you need to learn more about home. And one of the things that you can learn very easily is how to manage. We are going to talk about managing acute and emergency cases. As we said before, patients who can't talk to you, can't explain their situation, these patients rely on other people to help with their case taking. Another time when you use emergency medicine is when you are away from home. When you travel, for example, you're more vulnerable than when you're at home. You can't just go to your own doctor. This is a time when you want to have your homeopathy travel kit. Because if you have arsenicum in there, for example, and you have vomiting and diarrhea, arsenicum is like arnica. It's the remedy that will deal with this problem almost every time. When you're managing your cases, you also want to think about the conditions that define your relationships with other people, especially with the person who's the patient. So I'd like to talk to you about this sensitive issue. It's much more obvious when it's emergency medicine. But this is a situation where maybe you don't know the person and you need to figure out what their chief complaint is, what bothers them the most. But you don't know them that well. And there are other situations like these two situations where this could very well be happening in your own home. For example, in this situation, the child has lost their parent or their sibling. And in that case, arnica is the go-to remedy. It's not only for wounds, it's also for these emotional wounds in a child. If it's an adult, Nat Mur usually, or sometimes Aurum, is more appropriate. Usually they withdraw, and they're in very great contrast to Ignatia, who dramatizes their grief. They cry and they scream and they carry on. That's another form. Now in this case, the person, is he in panic or shock? Maybe he's hurt. But if he was in that car, he's in shock. He's panicked. Okay? Even if he's hurt. And the first thing you give him is aconite. Again, this is like arsenicum that I mentioned before, or arnica. There are certain situations where these remedies are the go-to remedies, and it's easy. Okay? But this is not that common. Actually, there are more situations that are less defined. You might have to really talk to this person. You can't just assume that seeking human kindness is a certain kind of person. You don't really know. You have to talk to him. In another case where you can use arnica in a very obvious situation, it's when you have a person who doesn't want to go to the doctor. They're afraid of the doctor. The doctor is going to hurt, is the way that arnica thinks. And I've used it before with elderly parents. It's very helpful. Thank you for staying with me in this talk about rather difficult subjects. This is the area that I personally find to be the most difficult, and that's helping friends and family. Of course, these are the easiest people to help. But you always have to consider what are their boundaries. If the problem requires further help down the line, how far are they willing to go? You know, people can only be helped as much as they're willing to go. So, how frank can you be with another person? You always need to think about this. And then there are mutual boundaries with a person. An adolescent can be very, very rigid about their boundaries. And in this case, it could be that the caretaker needs to help with the interview. You can't just interview the adolescent by himself or by herself. Another issue is private information. Most of what you learn from a case is private. And I personally don't write down all this private information. I might write down keywords, but I keep it at a minimum. And of course, you don't discuss these issues, because even when you're doing emergency cases, people feel that their inner world is being exposed, and many people don't feel comfortable to have their inner world exposed. So it's a delicate situation and something you need to think about if you're going to do homeopathy. So thank you very much. We're almost there. And I'd like to ask you to subscribe and to press the like button. But more than that, I'd like to ask you to get involved in your own healing. The intention of this channel is to give you the skills necessary to get experience using homeopathy, to get reliable results. You don't have to study for 20 years. By using modern methods that have been developed fairly recently to make the prescribing of professional homeopaths more accurate, but also for beginners. I'm assuming that you all have different styles and different needs in your life, and I'm crafting these lessons based on different kinds of people and different kinds of needs. So I ask you to email me. Tell me what is important in what I'm doing. How can I best be of help to you? If you go to this page, you'll see many of the videos that I've made. Thank you. This has been Tokyo Homeopathy, Ellen Madono. And thank you for listening to this broadcast. Thank you.